Hello, everyone. Welcome to today's webinar. Thanks for joining us. Today's webinar is about Workplace 2022, Shaping the Future of Your Facility. I'm Ann Cosgrove, the Editorial Director at Facility Executive, and this webinar today is presented by ABM. Before we get started, I would like to cover a few housekeeping items. Your panelists today will be on screen during their presentations, so you can pull down the section of your screen to be able to see them, whether that's at the top or on the side of your screen, then you should be able to see us now. I would also like to let you know that we will have a Q&A at the end from all of your questions out in the audience, so please do send your questions in using the question box in the control panel on your screen. You can access that question box make sure it's open by clicking on that orange arrow on the left side of your control panel, and then you will be able to access the question box, and we will answer those at the end. We'll also answer any technical questions behind the scenes. If you have any technical difficulty or non-content related questions, you can send a question during the presentation and you'll be answered privately. Also, if you are interested in continuing education credits, there will be an email sent from Facility Executive after the presentation, and you can present that to your association for the CEU. The conversation today will be a panel. As you can see, we have a group of panelists here today, and Ben Dodds from ABM will be moderating the conversation. So I'd like to give a quick overview of the folks we have today, and looking forward to a great conversation. So first we have, Nancy McClellan. She is CEO of Occupational Health Management. She practiced industrial hygiene management on a global scale for both AbbVie, a producer of biopharmaceuticals, and Lafarge Holcim, the world's largest building materials corporation. As a self-employed consultant for over 15 years, Nancy provides legal expert management training and select field services to many sectors, including pharmaceutical, automotive, military, hospital, electronic, food, chemical, education, and commercial facility industries. As a result of her combined experience, education, and certifications, Nancy was interviewed in 2020 on ABC's Good Morning America regarding COVID pandemic controls. So we're looking forward to her insight for sure. From ABM, we have Kevin Brown. He's Vice President of Client Solutions at ABM, and he has more than 25 years of experience in developing mechanical retrofit projects. Kevin's developed more than $1 billion in performance contracts with municipality, university, school, hospital sectors, as well as the federal markets around the US. He was appointed to ABM's Expert Advisory Council in 2020 and helped to build the company's enhanced facility program. In his current role, Kevin assists clients in achieving pandemic resilience with strong focus on improved IAQ. We also have Kayla Oliver on today. She's Senior Manager for Innovation and Client-Facing Technology at ABM. And in partnership with her colleagues, Kayla focuses on evaluating how emerging technologies can drive value for clients. Her efforts center on analyzing what facilities of the future will look like, determining the highest value use cases for technologies that are nearing maturation, and running structure pilots to identify solutions that should be scaled. Prior to her role here, Kayla supported ABM's corporate strategy team, and notably, she supported development of enhanced clean and enhanced facility programs with ABM. So we're looking forward to her insight, of course, as well, to see what solutions you all out in the audience might want to consider. Ben Dodds, last but not least, he is Director of Enhanced Clean and Enhanced Facility Programs for ABM, and he will really be kind of moderating this conversation today. He's been in the industry for over 16 years, starting his career with ABM in 2005 through the Diversco acquisition, and he has experience in various roles, including selling, developing, and implementing programs for the many aspects of ABM services, janitorial, security, landscaping, sanitation, and other integrated facility services. Ben transitioned to the position of branch manager in 2013, became regional director in North Carolina in 2018 for the newly formed Technology and Manufacturing Industry Group at ABM. And most recently, Ben has become the director for the Enhanced Clean and Enhanced Facility Programs as part of ABM's strategy and transformation team. So we're really looking forward to a great conversation here, and of course, your questions at the end. And with that, I will hand it over to Ben and the panel. Thank you.
Thank you, Ann. Appreciate that introduction. And we're very excited to be here as well. And thank you everyone for joining. We're really excited to kind of see where we are, right, with the current state of the pandemic as it sits today. And then what we've learned and those solutions, whether it be with what Kayla's doing on the technology automation side to other aspects of the business that we are making more efficient systems to reduce carbon footprint, to reduce the cost of the overall system efficiency, all with the eye towards creating, healthy buildings that occupants feel comfortable coming to. So with that, I'll jump right into kind of the current state of the pandemic. And we are really in that acceptance phase right now. And that's supported by kind of the recent CDC guidance that have come out saying, masks, they're coming off, mandates are being lifted. But on the flip side of that, there's always that possibility of the new variants that could be coming and emerging, and what that might do to efficacy of the vaccines that are being distributed. And, we had the bump of Omicron. We did have a bump of vaccination rates, but now we've seen, and supported by some studies, of those vaccination rates have been slowed. We know what happened with OSHA and the Biden administration push for private employers, vaccination mandates there. And now we're seeing, the new population, the younger children coming in from 5 to 11, that Pfizer vaccination efficacy after a month is dwindled down close to 12% efficacy. So a lot of concerns there, and a lot we need to keep an eye on as we continue to navigate through. And then also we're now looking at de-implementation of those public health preventive measures, whether that's contact tracing, the social distancing, isolation after a positive test. But this is going to be critical to understand those key metrics, to identify those pivot points on when should we re-implement some of these preventive measures. So these are going to be critical to put into facility strategies and business continuity plans as we move into the future. So yes, new normal, acceptance phase. You've heard the State of the Union. We want to bring people back into the office. We want to make them feel safe to come back to the office, but we have to be vigilant. We have to stay on our guard, and we have to pivot where necessary. Moving on to some of the reporting that recently came out from a Cushman and Wakefield study, and really how permanent was work from home. Well, as we go through some of these stats, it's really not that permanent. But some remote work status, it is expected to double over the next decade. And pre-COVID, it was about 5 to 6% of building population, going to 10 or 11 projection post-COVID. And then the hybrid work arrangement, which has become very popular, with 50% working from both home and the office versus about 25% pre-COVID. And then of those hybrid workers, 90% of those are still going to be required, still require workspaces. So if they're going in the office 2 to 4 days, we're thinking, how's that going to affect square footage within an occupied building? So to the square footage point, it's projected to go down 15 to 20% post-COVID, but then kind of ramp back up. And you'll see up to the charts to the right, when we look at how the occupancy is played, you'll see that down spike on that top chart. That was around the holidays. That's when Omicron was spiking. And then the charts below kind of show that returning to normal and coming back to the office, reaching pre-COVID levels, will be by July of this year. But on the flip side, a little bit slower on the square footage. Square footage is expected to get back to pre-COVID levels in 2024. So there's still a little bit of lag there as we work through navigating exactly what kind of space for our hybrid workers will look like. And, further support that study, in collaboration with facility executives, we did send out a survey, had several respondents, but, that lines right up. By July, most facility executives are expecting pre-pandemic levels. And then, what's really, great to hear is that over 70% of facility executives feel confident that they have a proper strategy or plan in place to move into the future. So with that, I know we're going back to normal and what that new normal looks like. And I want to bring in and welcome Nancy, part of our expert advisory council, to discuss some critical points around indoor air quality as well as disinfection. Nancy?
Thank you for that, Ben. Yeah. For reoccupancy, we really need to talk about indoor air quality as well as surface disinfection, which leads us to the point that in order for us to have lasting and valuable changes, surface disinfection continues to be very, very important. We know that from the survey that what enhanced protocols are being kept in place for the foreseeable future. Facility executives are reporting that they're keeping those preventative products. They're keeping the sanitizers and the wipes. They're planning on maintaining daily disinfection and also communicating those efforts that are out there. And this is really what's needed in order to go forward, especially when we talk about the topic of absenteeism, which brings us to the next set of information. In order for us to have broad protection against biohazards and attack absenteeism, which continues to be a major issue in the United States, we need to look at all the biohazards. And on this table that you see below, when it talks about the number of days, weeks, months, or years that a bug can last on a surface, you have COVID-19 on the far left, which lasts for a few days. But you have all of these other bugs, for instance, methicillin-resistant Staphylococcus, MRSA, as it's typically called, that can live on a surface for up to 300 days. And we have all of these biohazards or bugs that do impact our surfaces that need to be addressed only through surface disinfection. And really, this pivots around the absenteeism issues that we're still faced with, where we know that it's a big drain on any organization, and it is the result of viral and bacterial infections and indoor air quality. When we talk about indoor air quality in the next set of information, we know that COVID has caused a shift in our mindset regarding indoor air quality. There's actually a heightened awareness, and people are shifting toward more thinking, and facility executives are thinking more about wellness of their work population or their occupant population. COVID simply drove it forward faster. And we've always had wellness initiatives, we've always had green initiatives, where we're talking a lot about healthy and safe environment, but the pandemic definitely drove this forward faster. And so a lot of services that in the past were reviewed as just overhead or an operational expense are now being positioned as critical. Critical because they're a component to employee health improvement and wellness, and they're a strategy used to minimize both airborne and surface transmission risks. So with wellness, with COVID vaccines available, we all need to consider looking for those trusted partners in order to find the long-term solutions, and beyond finding them, communicating them to the occupant population that's out there. We really need to boost confidence. So in order to boost confidence and looking at what numbers we might share with an occupant population, we need to look at ventilation and viral sources. When you combine poor ventilation and viral sources, we know according to the National Institute of Occupational Safety and Health, NIOSH, that you get a transmission risk. And poor ventilation happens to be the most common issue that creates an unhealthy building. And so poor ventilation and the need for improving it became a very heightened issue during the pandemic, because we know that COVID was primarily airborne. And we don't often have complete control over what walks into our building, which are the viral sources entering, but we do have the technology in order to interrupt that transmission by doing improved mixing of air, improved filtration of our air, and disinfection. And so that large portion of factors that impact that, we have the solutions. When we look at what we measure in indoor air quality, we look at 7 measurable and controllable indicators of facility wellness that are part of indoor air quality. We have particulate matter, which could be dust, but it could be also aerosols that are carrying the virus. We also look at volatile organic compounds, but basically the odors and the smells that you might have in a building that are produced not only by occupants, but also building materials, furnitures, wall coverings, furnishings in general. We also have the impact of air volume, mixing and balancing that needs to be done in order to make sure that the indoor air quality factors are controlled. We also need to look at carbon dioxide and carbon monoxide kind of as markers for whether the air is being moved through the building and clearing away not only carbon dioxide and carbon monoxide, but also those VOCs and particles. And also for comfort and for building maintenance, we have to look at temperature and relative humidity, because we know, especially with relative humidity, the increase in humidity can grow mold if it's too extreme, but if it's too low, we end up with respiratory irritation and a greater ability for those viruses and bacteria to transmit and move and find a home in a human. And with that, I will turn it over to Kevin, who's going to talk about living labs, where we're actually looking at indoor air quality and the technologies that can affect it.
Thanks, Nancy. So in our living lab is an experimental space, but it's actually our live office space. This is our Tustin office in Southern California. It's a joint office with a couple of different industry groups from ABM. It's got our local mechanical branches in there, some aviation folks, some folks from the engineering and on-site, and I believe a couple of folks from our business and industry group. Anyway, the purpose of the lab itself was to answer those questions of where have you tried this and what are you trying to deploy and how do you measure that it's actually working. So we've got a bunch of different technologies deployed, a bunch of indoor air quality monitors and sensors that are deployed right now, where we're trying to evaluate them against an actual industrial hygienist report with known contaminants inside the space, just trying to see what registers what. We did deploy Safe Traces as Veridart to find out exactly how aerosols are moving within the space and found some fantastic results. Now, keep in mind, this is our building. This is a building that we did a tenant retrofit inside of. We're the only tenant inside, and it was designed to our specifications. And we found out that air was not cleaning out like it was supposed to in our office. So it immediately made us take some action. We deployed needlepoint bipolar ionization technology, noticed some significant changes on the indoor air quality with that, found out that we still need to go a little bit further. And so I think the next round we're going to look at getting some testing and balancing and adjusting the airflows inside the space. This is an open office, open floor plan kind of thing, where you've got the glass conference rooms and a whole bunch of wide open space. So I know a lot of you have probably got the same building types right now. So the results were pertinent, they're actionable, and they're measurable. So that was the big message that we gathered from our testing. Then I think we can go on to the next one. Let's talk about all the technologies that are at play out there right now. So what the Advisory Council for ABM has done is gone through a lot of these different vendors and narrowed it down to a handful in each category that are either the original patent holder or have shown fantastic efficacy through third-party studies, peer-reviewed studies. With bipolar ionization, depending on the system size, we've gone back and forth with needlepoint, especially for small systems, and then for large systems, sports arenas, things like that, we really like the dielectric product from Atmosphere. As we get into hydrogen peroxide, now this is another technology that's been around for a while. This was, I think some of the original technology patents for this came out of the anthrax scare, if you all remember that back in the 90s. So this is really a UV lamp shining onto a titanium dioxide screen. The device itself is shoved up into the ductwork, so it's mixing with ambient humidity, and it makes hydroxy radicals that move downstream and just attack whatever they can. Safe for people. We had no problems when we measured it in live action scenarios or where we've actually deployed it in live office spaces. We actually got really good results on effective kill rates. So a highly recommended technology. They make a great portable device. A couple different manufacturers make devices that can fit inside of mass transportation if you're looking down that route, say your bus fleet or something. For the HVAC side, UV and UVGI, germicidal irradiation, has been around for a long time. This is one of the reasons why ASHRAE has endorsed this technology specifically. Probably 70 years installed in various applications, started in healthcare, I believe, and it's moved on to doing a great job of killing bacterial buildup, you know, the algae that you get on the wet side of the cooling coil. Really good technology, really effective. I still use it for keeping algae off of large cooling coils, but it does have some effectiveness against the bug or a bunch of other bacterial particles, so added benefit. Keep in mind, none of these are a silver bullet. There's not a single technology out there that is 99.whatever% effective in a live environment. They might be that high in a lab, but we're not getting numbers like that when we deploy them. Filtration, ASHRAE is still recommending a minimum of MERV 13, but through a combination of different technologies, you can actually get really good results with much lower MERV ratings, including MERV 8 or MERV 11. So if you're curious about, you know, maybe my air handling unit can't handle MERV 13, there are definitely options you can look at. Now on the lighting side, there's a bunch of technology out there. This has been a boom for the lighting industry. So you're seeing a lot of far UV technology, stuff that's safe to shine down on people. You still got UV as well. That's not safe to shoot. They're the middle range of UV, UVC, where it's not safe to shine on people because it'll burn eyes and skin, but you'll see it in high bay applications where it'll actually run through a diffuser and be installed at the 7-foot mark so it doesn't actually hit anybody. But it does a good job of taking care of mold, mildew, COVID, whatever bug is floating up in that, caught up in the turbulence of air moving inside that building. We see some robotics, but they're really being deployed right now in healthcare. So I don't see it moving outside of healthcare anytime soon, just because of the expense of the device. What has been really interesting, though, that's coming out of this recent wave is the higher implementation of UV that's generated by an LED light source. So now you're talking about things that don't need to be made out of pure glass, things that last way more than 8,000 hours. So intriguing. On the next slide, I think we're going to talk about, yeah. So this is kind of a snapshot, a little diagram of which technologies are really effective and where, and what we've been able to find and support in documentation. It was an easy way for us to compare with customers, you know, what do you have deployed now? What else do you need to complement what you already have? Where do you want to take the building? And we included the baseline for comparison over here. So just a nice little quick reference. We include operating characteristics in our analysis as well. So you've got that first cost, but what does it actually cost to maintain that equipment over time? You know, what's the labor burden? What's the parts burden? We found quite a few manufacturers that we threw out because it costs more to maintain the equipment than it did to buy it. Wrong model. Now, we avoided portables for a very, very long time just because of the nature of the device. I mean, portable to me meant that it could get up and walk and leave the building. And we really didn't want that to be a go-to strategy. And then we started to understand that a lot of our customers don't have access to the air conditioning system, or they want to take that extra stance and put something into a space that people can see and touch and hear. So we came up with we vetted quite a few of the technologies and came up with one that we really, really like. One that's really effective in larger spaces. It's a combination of technologies built inside this box, but you can size them for small rooms, conference spaces, really big spaces, and the price was really good. Maintenance on it was good. So if you have any questions about these, let us know and we'll connect you with the right source. And with that, I think I'm going to turn it back over to Kayla.
Awesome, thanks. So I'm super excited to be here today. Kevin shared a bit around our living lab and how we're thinking about disinfection technologies and just how the continual vetting process is working there. But what I think is very exciting about where our industry is headed is that these disinfection technologies are one layer of it, and they're interacting, or they will be interacting, with these other emerging trends and technology categories to unlock even more value for how we think about management of facilities. And that's what our living lab is really set up to enable us to do. So we're focused on looking at not only these individual technologies and the value that they drive, because each individual technology will drive some value. Sorry, but when we think about where facilities of the future is headed, there will be this interactivity between technologies that unlocks more automated, efficient, and remote ways of managing your spaces. So to accomplish this and make sure that we're testing out the right things and the right interactivity in our living lab, we have to keep a pulse on not only where our industry is at, but where it's headed. And so one thing that we like to do is document what the emerging trends are for our spaces, or for our industry, I should say. And you can see some of these on the page. It's important to keep in mind that these are not necessarily what's here today, but these are things that are popping up that we think will be more and more prevalent, let's say 5 years from now. And I just want to talk through a couple of them. You see IoT and sensor technology on here a few times. Those are one of the trends that I would say is closer to the now. Those are common terms. You can even see it in our day-to-day lives outside of the FM space. So I'm sure many people's fridges are IoT enabled, or even your Apple Watch is a great example. And just for context, IoT refers to Internet of Things. It's essentially a technology that captures and sends information about something. And sensor technology is a type of IoT that uses a sensor to capture that data. And sensors, as you all well know, are in facilities today. But where it's headed is more advanced and integrated ways to use the data that's coming in. So if we take the example of sensor or occupancy sensors, I should say, that data in of itself is great, but it's really how you use it that becomes powerful. And where we're seeing things head is not just in using that data itself, but using it to connect to other parts of the facility. Like, for instance, having an automated way to think through when lights and doors are locked based on the last time that someone leaves. So after a certain hour of the day, when there's no longer occupancy in the space, then automatically security controls go into effect. Another example that we're seeing is this trend towards more personalization, especially as we think about the new ways of working and what reoccupancy looks like that Ben shared earlier. We're seeing a desire to have more personalized experiences as individuals enter the space. And I think one theme that I'd like to highlight throughout all of this is data. Everything that you're seeing on the page has a data element to that. And that's really the secret, in my opinion, for facilities of the future. It's these underlying data connectivity webs that each individual technology produces, but it's using ML or APIs or integrations between different technologies or the BMS to unlock new use cases that drive value. And the digital twin is sort of the pinnacle of that today. So when you think about all this data, dashboards are fantastic and obviously important, but there's only so much that you can visualize in a dashboard. And a digital twin allows you to take a 3D replica of your space and pinpoint all these different data points on it and really see at a much more actionable way what's actually occurring in your space. And then you can also use that, again, when we get to this facilities of the future, to have automation around when different controls are adjusted based on, again, automatically the data that's coming in, or you can automatically deploy certain pieces of equipment or trigger certain servicing alerts. And all of this, since it's digitized in a very visual way, can also support more remote management of your space. And so how does that actually come to life? This is just a quick visualization of it. This is what facilities of the future could look like. And again, just a key theme is that each individual technology drives value. But the real magic comes when we think about how you get more automated, efficient spaces, is that interactivity. And so just a quick example is VR. This is something that generally most folks associate with the video game space, but we're actually seeing it pop up in other industries, and it's something that we think will affect the FM industry more and more in the coming years. So a perfect use case for that is supporting training. So let's say that a team member or a technician was servicing a filter, and they just wanted some real-time support to make sure that they did it in the most efficient, effective, and safe manner. VR can support that. But you can picture this broader ecosystem where some of the IAQ information that Kevin was alluding to earlier informs when that filter should be changed. And then the technician that does that has the VR there to support them in doing it effectively. So essentially, all of this is connected to create an environment that drives servicing and optimization of what is occurring, optimization of servicing, as well as broader management of your spaces. And so really, when we move to this, there's a number of benefits that will come from this. So just want to highlight a couple of those next. And in particular, what I want to highlight if we move to the next slide is just that as these things come together, you will have the ability to automate how you think about management of your space. So I alluded to this a bit earlier, but just to highlight another example, let's think about predictive maintenance. So today, to use that filter example from our facilities of the future visualization, today, often filters are done or changed on a certain schedule. And that's great, and it's based on best practices and what is known about your facility type and that filter type, but there's room to optimize that when we actually have data around when the filter needs to be changed. So now it can be changed at the right time, and alerts could be sent to the team member or appropriate service individual to make sure that the supply is there, so there's no waiting for the supply. So ultimately, it makes sure that your facility is always running at its optimal performance and that money is being spent most effectively, so filters are not changed when they do not have to be. Another big benefit that I like to highlight about where facilities are headed is that for facilities managers, it gives you more control over how you want to run your spaces. So if you have particular goals, this technology is an enabler to help you get there. So a perfect example is when we think about the return or reoccupancy for facilities, and especially with that trend around occupants desiring more personalized experiences. Let's say your goal was to really focus on the end user experience and make it a completely optimal experience for them. In the current state, there's only so much data that you have to support that. In the future state, when we get to this facility of the future, you'll have the ability and the data to drive better decisions to create the occupant experience that you want. So a simple example of that is when we think about occupancy sensors. Right now, servicing is done of restrooms based on what we know around how it's used. When you actually have data around patterns of usage and also abnormalities of usage, you can make sure that the servicing is always done at after a certain usage so that your occupants never experience a service level that you don't want them to in the restroom. And I think the main theme that I will keep highlighting today is data. That's really what all these technologies allow you to do. And it's complex because to ultimately achieve that facilities of the future, there has to be this underlying web of how the technologies interact with one another. But it ultimately allows you to unlock new use cases and new value drivers for your space. The one thing that I do not want to give the impression, though, is that I would say there's two sides of the coin. One is that facilities of the future isn't here yet today. But the other side is that it's not something that you can't start on. There are technologies that are mature enough to drive value today, and it will be a continual building block to implement technologies that drive value based on your needs, and then pull in others over time to drive additional value and think about that interactivity to ultimately achieve facilities of the future. And the last thing that I want to hit on today is just that ABM is here to support you with that journey. So we have stood up a formal innovation program, and that is called ABM Next. And that refers to, we are thinking about what's next. And I won't spend too long on this, but just want to highlight a couple key points. The first is that we do place a big emphasis on listening to the needs of our clients. So what I mentioned on the last page is that it's important to start this journey and think about use cases and technologies that would drive value to you. We're here to help advise on that. And a big part of our program is making sure we're listening to our clients' goals and pain points to identify technologies that can help. And the other key point that I just want to highlight is we have dedicated R&D funding set aside to run prioritized pilots, some of which occur in our living lab, and they all follow a structured pilot process. And Kevin showed you a bit of that earlier, but that structured pilot process helps ensure that we can identify viable, scalable solutions that drive value for our clients. But with that, I do want to make sure that I can hand it over to Kevin now to talk a bit through sustainability.
Thanks, Kayla. I tell you, it's been a wonderful to work with Kayla and the team on what's going on in the Living Lab and all the different technologies that we're testing and the stuff that they're bringing to bear. It's fabulous. It really is, to me, it's probably the way that buildings are headed. Mostly because it all hinges on that monitoring-based continuous commissioning kind of platform. I see things changing. And as what many of you probably realize, that LEED buildings or rated buildings tend to stay, they already command a higher rent, but they tend to stay occupied a whole lot longer. So we had a couple of survey questions that went out regarding rated buildings. I don't know if it was specifically LEED because there's so many other rating systems out there, Green Globes, BRAM, WELL is taking a pretty good stance at this point. But the LEED buildings were charging more for rent. They were actually, earning what they were supposed to, paying off that accreditation. But then there's a bigger social component to it that people felt safer in rated buildings. I know there's a couple of other programs coming out. I think UL is actually putting together a program related to ventilation and filtration and giving a badge to buildings, which will come with some conveyance of how safe that space is to the public when they walk in. And they're actually using Safe Traces and Veridart to validate it. One of the other questions that we saw was related to plans towards becoming greener. Have you implemented any changes to the building? How big is carbon reduction to you? And is it beyond just energy costs at this point? So for years and years and years, we had a whole bunch of buildings out there, or a whole bunch of entities out there, corporations, that always had we should save energy, we should save, and reduce our carbon footprint. And there was always this nice carrot to do it, but there was no stick. There was no, there was no mandate. There was no penalty if you didn't do it. It was, we'll get to it if we can kind of thing. That's changing. Even ASHRAE is now coming up with a whole bunch of different standards about, let's switch to the next one, about how do we well, first of all, we propped up the epidemic task force back at the beginning of 2020 or 2020. And the epidemic task force did a great job of trying to at least get an official position out there to the public. Since the epidemic task force was out there, there's going to be a new major task force from ASHRAE focused on building decarbonization. Now that thing's got 9 separate working groups talking about every aspect of the industry, including education, to the public. I expect great things out of that as it rolls out. And ASHRAE just recently put an MTG together focused on resilience. I'm a member of that MTG, and we'll be coming up with similar guidelines about how to maintain buildings, or at least how to continue to operate buildings effectively in the wake of some disaster or something else. So stay tuned. There'll be more to come on that. Now, the services that we provide related to carbon neutral buildings, this is just a cute little snapshot of what's going on. A lot of these are captured in our normal bundled energy solutions programs. We're doing it not one-off, but we're doing it piece by piece with other entities that don't necessarily need that whole financing vehicle to make the deal go through. So not necessarily a performance contract, but the entity now has a vision and a path to move forward, and they're looking at things that aren't just simple, quick payback items, or they're looking at ways to, augment their ability to serve their customers. We do a tremendous amount with electric fleets and EV charging now. Energy storage is becoming a bigger deal. We've done quite a few projects with adding batteries to buildings at this point. So keep us in mind. And with that, I think I'm going to turn it back to Nancy.
Hey there, thanks, Kevin. Yeah, on that note, when we consider what evolution our buildings need to go through, what kind of roadmap they might be, there's really a continuous improvement process that building executives, facility executives need to engage in. What usually starts us in the planning part, in that plan, do, check, act cycle that's continuous improvement, is there's usually a motivator at the beginning of it. Things like wildfires. If you're in a region that produces wildfires that have particulate matter that's just at crazy levels coming into your facilities. Obviously, pandemics and biohazards that are out there. But we've also had in the past, and certainly going into the future, general indoor air quality concerns. And then also facilities that have high demand clients and simply expect a much higher standard of that well building, that green building. And so in order to prioritize and do what needs to be done in order to start that journey as a facility executive, you need to discuss your past and your current status of your facility, and discuss what those indoor air quality and business continuity impacts are. If we were to have a wildfire in your area, or if we were to have another pandemic or epidemic, are you postured in terms of business continuity and how your facility operates in order to address that? You also need to consider performing a healthy building risk assessment. Risk assessment in general allows you to prioritize where you're going to spend your effort and going to spend your resources. So that risk assessment process helps you identify and narrow what it is that you have yet ahead of you in order to improve those business continuity impacts and improve the indoor air quality in your facility. And then also performing indoor air quality evaluations as well as HVAC evaluations, determining if what you currently have is sufficient. And for many of our clients, in performing the healthy building risk assessment and doing evaluations, they've determined, hey, we're in pretty good shape and we just have some minor tweaking. And then others have said, okay, we've got some work to do in implementing controls. Controls are part of checking what is out of order, where we have gaps. And so reviewing that healthy building risk assessment, reviewing data that comes from indoor air quality investigations and tracer evaluations of your ventilation system, all of that data goes into the decisions that you're going to need to make, prioritize and implement technologies. And those technologies could range from everything from portable units to HVAC installed units, lighting technologies that all provide air disinfection. And then also indoor air quality continuous monitoring systems that actually provide feedback to your building automation system. Those are things that are here now, things that give you the data in order for you to reassure your occupants that the environment that they're in for most of their day is an environment that they want to be in. And then closing the loop on any continuous improvement process, we have to act. We have to come back full circle and continue to improve what we have done, check what we have done to make sure it's effective. So looping back and testing the effectiveness of the technology becomes important. Assisting with the facility indoor air quality and building automation system metrics. What are you going to do with that data beyond the day-to-day interpretation? Because those metrics can go into your capital expenditure planning process, your long-term planning, and then also introducing additional technologies that address carbon reduction, energy savings, that address maybe regulatory changes. So engaging in this cycle is really how you put your foot in the water at the beginning, and you engage in order that you're continually improving the wellness of your building, providing the best environment for your occupants. And with that, I'll turn that back over to, I believe, Ben.
Yes, thank you, Nancy, Kevin, and Kayla as well. Really, really cool stuff, and definitely a lot to think about as we move forward here. So wanted to quickly just talk about some solutions, right? And we have stood up 2 unique solutions, not only as a response to the pandemic, but also more of a holistic program going into the future. It's from the things you touch, whether it's the surfaces to the air you breathe, right? That's really where we're focusing here. And enhanced clean, which is surface disinfection, is a 3-step approach. That first step is a one-time disinfection to kind of level set or restart an area. Step 2, which is high volume for ABM, and one of our most utilized service is that frequent high touch disinfection. And not only is it critical to address those surfaces, but it aids into that safety scene side of the perception for building occupants. They can actually see us providing the disinfection service. And then the third step is layering in more of the broader disinfection for large areas, utilizing the electrostatic sprayers. As we move to the air, we've developed an enhanced facility. And again, that's another 3-step process. You've heard from Nancy about what we've done with our healthy building risk assessment. This was developed alongside our expert advisory council. And it's really that first step to understand what your building facility risk rating is from low to very high. And then from there, we can report out some fact-based recommendations to improve indoor air quality. And it's really to help drive that conversation to align on the path forward. And step 2 is where we take those recommendations and actually act on them. So that could be control settings in the HVAC systems. It could be performing an indoor air quality baseline test. Could be installing air disinfection technologies or lighting technologies that Kevin mentioned. And then in step 3 is where we want to build in that resiliency, right? And that could be setting up a IEQ test to make sure what we thought at the beginning is holding consistent as we move out. Making sure we have a solid preventive maintenance program on the system, and then even building in, backup power, additional resiliency on that side. So together, right, it's a holistic infection control program that is going to aid in reducing the viral transmission. And this is all with the goal of keeping people safe and allowing you to build greater occupant trust and confidence as these occupancy starts to increase and we want to bring people back to the office. Couple of success stories I just wanted to touch on real quick. On the enhanced facility side, this was actually a manufacturer in Texas, but as ABM standard operating procedure, we have these regular check-ins, client business reviews. This one, which happened summer, fall of 2021, where we, talked about enhanced facility. We had one of our specialists there as well, and kind of what that all looked, how that process looked. That triggered, okay, let's do that risk assessments. Let's understand the rating. Let's see what recommendations we can discuss. And the path forward there was that client able to work this into the budget plan for 2022. And we're able to customize into a couple phases. So phase one, which is going on right now, was installing that needlepoint bipolar ionization, doing some controls commissioning, and then looking at that IQ testing and monitoring. Now, if we're able to validate some of those solutions with that IQ testing, we'll definitely move in and expand further into phase two. On enhanced clean, essentially, this is a client out in the West Coast that was bringing back occupancy. And there comes a point where, what we've done with, let's just say, our day staff, there was a lift and shift, getting off, a base portering scope and then moving towards more of the high touch point cleaning. There's a point where, as occupants increase, getting back to the base scope, right, but still wanting to provide that high touch disinfection is where that we lockstep, understand reentry plans, and be able to evolve and flex on the client needs and what we need to do with our staffing. So we're on the forefront there, and just another example of partnering with our clients. And then lastly, just to kind of wrap this up, a return to normalcy may lead to complacency. We're all very excited at trying to come out of this and hopefully making this an endemic. But we do know how fast Omicron spread. What else is behind it, right? So we have to be on our toes. We know occupancy rates are going to return to pre-pandemic levels, hopefully by the summer here, but also it will still be less people in the office due to the hybrid work policies. And then disinfection is the new expectation of building occupants. People want to see safety, and that high touch point cleaning is a critical piece to it. Indoor air quality, as Nancy mentioned, Kevin, Kayla, whether that be with the technologies in there, understanding airflow patterns, or just wanting to monitor air quality and take action if it goes out of parameters. And then lastly, healthier facilities. That plan, it's not just about preventing the virus spread, but creating those protocols backed by research, the technology to increase the efficiency, minimize carbon, reduce absenteeism, all the good things that we should be doing. These programs can help shape that strategy along with you. So I'll leave you with more information. Visit our healthyfacility.com and you'll be able to look at more info. And with that, Anne, I'll open it up over to you for Q&A.
Okay, thank you. Thank you everyone for your presentation, your talk today, and thanks to our attendees for your attention and your questions. We do have a short bit of time, so we'll jump right in. Let's see, I'm going to start with a specific question. We do have a couple of general questions, but the specific question is, what portable unit would you recommend for a bus? We have a bookmobile that could use something like this.
Yeah. So there's a couple of different technologies out there that are really perfectly designed for this. Casper, C-A-S-P-R, take a look at what they offer. It usually powers off the air conditioning unit that runs the bus anyway, and it's going to be inserted right there next to where the air conditioning unit itself is. What I love about the dry hydrogen peroxide technologies is that the the ions, the hydroxy radicals are big enough that they don't decay right away. So they tend to settle onto surfaces and continue to disinfect for quite a few minutes before they just dissipate completely. So extra bonus.
All right. Thank you for that. And now I'll jump into a more general question and looking at buildings, I'm assuming. And the question is, with so many conflicting priorities when it comes to HVAC and IAQ, how do you pick between, or how do you evaluate between the energy efficiency goals, carbon reduction, and improving indoor air quality? What kind of balance have you seen as far as being effective there with evaluation?
Yeah, I'll take this one as well. So it's not so much a choose one or the other, because they kind of all feed into the same goal. So if you're going after better IAQ, you can do that and make the energy footprint better as well. To Kayla's point, this is all about measuring what's actually going on inside the space. So the more data that you have, the more information you have coming back, the better informed you are about what you can actually do to control and make the space comfortable, but efficient and healthy. And
okay, thank you. Sorry.
Sorry.
So another question, and this it came in the beginning, so maybe this is for you, Nancy, or whoever, of course, would like to answer. And the question is, or the comment really, it's COVID cases are down, mask requirements, mask mandates are going away in many places. So why should we continue to invest in protocols that were in place during the early days of the pandemic? Can Nancy or whoever wants to take that? Can you talk about that a bit?
Yeah, I can take that. That's an excellent question. And I know it's on the minds of the people that are in the audience. First of all, absenteeism, it's a big drain on any organization. Absenteeism is a result of viral and bacterial infections and poor indoor air quality. It's been at an all-time high, and it still continues to be very costly in the US. Centers for Disease Control estimates that it's as high as $286 per person per year, and that we've lost $227 billion as a result of lost productivity and absenteeism. And that's because illness is the leading cause. So there's solid evidence, first of all, that we can effectively reduce absenteeism with continued surface and air disinfection. So, there's just a strong case for it. Second of all, and certainly not least or lesser than the issue of absenteeism, is occupant confidence. Confidence that the facility is clean, that it's well, that it's a place that you want to spend your day in. And so it's critical that people see those outward efforts, that they see data from indoor air quality monitoring, that they see outward evidence that they're in a place that they would want to spend the majority of their day, which usually is the case when we talk about workplaces. So, those two reasons, absenteeism and occupant confidence, are really what is driving it. And we have the technology, so we should continue to implement it and move this initiative forward.
Okay, thank you. We have time for a last question, and I want to let everyone in the audience know if your question has not been addressed, it can be addressed directly by the team, so it will not be lost in cyberspace. So this last question, I just want to get this out there because a few folks did ask it about the living lab that you all talked about, the ABM Living Lab. Can clients or prospects, those in the audience who are interested, can they tour the living lab, or how can they kind of interact and learn more about that? What's going on there?
We're just getting to that point. I think Kayla was helping us put together a bunch of additional marketing information, because like I said, a lot of this stuff is just, it's widgets that are installed either in the air conditioning or behind the scenes. So we wanted to build a nice public facing case to go with it. I think we've got our first tour about to be set up with one of our clients now. And yeah, that's how we're going to roll it out. And
so how would folks find out about that?
Reach out to us directly. You can either reach out to me or Kayla, and we'll take it from there.
Yeah,
okay,
and they can always go to healthyfacility.com, and there's a contact us form in there as well.
There you go.
Okay, awesome. All right. Well, I think we are out of time. As I said, if there's any questions that we didn't get to attendees, they will be addressed offline. And thank you very much for your time. Thank you, panelists. Really appreciate it.
Thank you.
And of course, I would like to let you all in the audience know that a recording from today's session will be available on our website, facilityexecutive.com, also through ABM, and you can visit healthyfacility.com for the specific information that we've heard about today. ABM's website is abm.com as well. And thank you, everyone, for your participation. Have a great afternoon.
Thank you.
Okay, bye-bye.